Greetings and welcome everyone to another episode of Oral Pathology Tuesdays, brought to you by Oral Pathology 360. This is where we get together every week to discuss matters and the latest research and cases and so much more in oral pathology, oral medicine, and all the diagnostic sciences of dentistry. Although today is a very oral pathology related topic, it's more about our career horizons and what we can do in oral pathology. Well, if you are new here, please hit subscribe and stay with us. It's going to be very interesting. And for everyone who is back with us, including Dr. Vivek and Professor Hill, well, hi, welcome. And let me just share. We have a little information about the conference before we go on. So, this is to tell you that the International Oral Diseases Case Presentation Conference, or IODCPC for short, is back, and this is the third edition. And we are going to be having another completely virtual event in a marvelous platform called VFairs. It's very interesting and gives us a lot of opportunities for very interesting interactions and presentations. You really won't feel that much that it is not in person. And these are all the marvelous co-organizers, the our global partners from around the world who are academic and knowledge partners. And of course, the registration is open, and case abstract submission is also open till the 1st of April. So please hurry. It's either an individual case or case series. No research. I'm sorry, many people are asking, but this is a very definite case presentation conference, and therefore the name. And of course, it's going to have all the normal things. There are excellent guest speakers, there are keynotes, both in oral radiology this time and oral pathology. And of course, there are going to be case discussions with experts who, as always, will be there to give you a commentary on what you have presented. And a very interesting thing is this time that we will have the abstracts published in an ISBN registered book, although that will still give you the possibility to publish the main case if you want to. And well, that's all very fast. And of course, the author, the presenter, and everybody who is else is a part of the presentation and who is registered for the conference will also get a certificate for the presentation. And we are going to get somewhere between 12 and 18 CDE points. So it's all good. I do hope to see you all there. It will be fun. And right, so with that, let me just skip back to yes. And let me welcome our guest, Dr. Ramya. Yes, she is with us from Savita Dental College. She is the um, assistant dean, associate dean, I'm sorry. And also, she is the head of oral biology there. She'll give us a little more introduction about herself. Yes, hello, Dr. Ramya. You want to just say a little more since I didn't remember it all?
Yeah, yeah, yeah. Hi, Dr. Mandana. It's so nice to meet you in this wonderful and brilliant platform, I would say, the most needed for our specialty. I'm just watching your work for a very long time. You've been doing great, and this platform, especially, I would say, is something which the younger generation of oral pathologists should definitely follow because there's lots which you're doing. It's highly commendable, and yeah, it sounds really interesting. And I'm really honored to be with you in this great platform. Thank you.
Thank you so much. Thank you. It's wonderful to have you with us. So, with that, we're going to go as usual, watch the video, and then come back. She has some very interesting things to say about what we can do with oral pathology degree. So, and then we will have a discussion.
Good day. We are here to discuss about the careers in oral pathology and how it is a treasure trove. This is Dr. Ramya, oral pathologist from Savita Dental College. So first, as a quick look, let us know what the BDS program has done to you as an individual. This particular program is so unique that the curriculum is designed in such a way that the learning domains have all been utilized in its best possible way, making a very big difference than the other specialty. And what has the MDS program done to you? It has offered you even much more. And here, just a quick consolidated curriculum, what the MDS program is all about, and it has made you wholesome. Did it stop with that? A combination of a dentist and a oral pathology specialty is actually a super brilliant combination with the highest degrees of aptitude. And that is what I've been witnessing for the past 17 years of my career as an oral pathologist. So, to look into the basic foundational aspect of oral pathology, the histopathology is what we are more keen, and what is the most fundamental aspect of oral pathology. We use the microscopes and we analyze and identify patterns. Is it all that? And yes, the microscopy helps us delve very, very deeper, and it helps us seeing the unseen. So that is something which we alone are blessed with than any other clinical profession. So we see most and beyond which no other specialty can see or no other clinicians can see. And that helps us visualize the unseen dimensions, and that makes us a step further or gives an edge over any other specialty. So these words of a very unique aspects of our specialty is something which the younger generation must keep reminded about, and you must always keep telling you that you are definitely an edge over the others. So first, into the routine career aspects, oral pathology teaching is what was the basic career option which was available when I passed out my oral pathology degree, and I was immediately given the post of oral pathology teacher because during my times there were vacancies all around, and I had the privilege of joining my own alma mater after my post graduation. And once you do that and once you join, so this is a very interesting aspect because somehow or the other of seeing postgraduate, doing postgraduate teaching for so many years now, it is very evident that somehow the specialty teachers to become very good teachers. And that is because the depth of knowledge which we gain over the period of the course, we all are very good teachers. We are very good in explaining things. That is mainly because the depth we take in reading each and every disease. So I would rate oral pathology specialty as the best teachers. And you can also take that opinion from any one of your students. Always, this is where, wherever I meet students, they say, our college, the oral pathology department teaching is very good. So that is, again, becomes inborn and we become very good teachers. And the next interesting thing, which is currently available, the way COVID changed the world for, I would say, good. So that has again opened up the entire world to us. So the globally we are, I mean, nothing is far. It's all in your hands. And in case if the routine college teaching is not available and teaching is very passionate to you, please start looking for online teaching platforms, and you can become a teacher. And it's just not restricted being in a single institution. You can extend your teaching capabilities to a wider platform, and that again needs a lot of hard work, but keep exploring. You will definitely find a very interesting option. The next part of typical job options or typical career options available for oral pathologists are oral pathology consultations, which I very frequently encounter. Your friends, your immediate known circles keep calling us for oral pathology consultations of identifying lesions or identifying any abnormal areas, or it can be any other difficulty which they are facing in diagnosis. So I usually tend to advise my students that the common question is, we are only oral pathologists, should we start a clinic? The first thing which comes to me regarding questions about clinical practice is, as is your pathology, so is your practice. And this applies to every dental graduate student and, of course, the postgraduates as well. So, if as is your pathology, so is your practice, that statement is something which is very, very important, which all of us should keep telling to us on a daily basis. So, what does that mean? Diagnosis and treatment planning are the key to any clinical practice or a successful clinician. And that again comes to us basically as a basic training with the postgraduate program. So you can do fantastic oral pathology consultation offline or online. So again, the world is open to you. Oral pathology online consultations are available. And again, it's up to you to go and keep exploring. So how will the world know that you are available for oral pathology online consultations? Keep developing your social media handles very, very strongly. So there are always concerns about having a very nice social media page and being present in the media. There are complaints about it takes a lot of time, and there is always a risk of hacking and so on. But please do understand there is a huge amount of benefit. Showcase the world who you are. And once the world knows who you are, automatically the world would generate everything what it wants from you. And the next very interesting thing is, of course, a medical transcription option. Medical transcription options are again, I would say, perfectly suits our specialty than any other specialty, because being a pathologist, you would understand medical report than anybody else. And if you get a chance to join a medical transcription company, I would say take the plunge, because it would really suit you and you would really become leader very soon. The other routine jobs which are commonly available for postgraduates, oral pathology postgraduates are residentship and of course senior residentship as well. And junior residentship comes with BDS degrees, and you can also look in for other resident programs which come after post-graduation, specifically looking for oral pathology kind of postgraduate programs. I've seen my own students being recruited in very highly reputed colleges. We recently had a student being recruited as a research fellow for a project related to liver diseases. And that was a grant, a bigger grant project. How did that student fetch that plum job in a very reputed institution? It was because of the profile which he passed out with, and with the way he convinced the team, and they were ready to take an oral pathologist for a liver research work. So that is how it can be extrapolated to many other domains as well. And the other interesting aspect of oral pathologist is that every college, I'll say randomly, every college, every dental college in India, oral pathologists are favored academic administrators. You can just, if you're in any college now, just look around. The oral pathology department would be doing some kind of administrative role. Why is it being given to them? It is not because they are the non-clinical side. It is definitely not because of that. The aptitude which an oral pathologist has cannot be matched with any other clinician. I can boldly declare that. And I can even proudly say that in our own institution, we have 3 associate deans from the oral pathology department. And that again showcases the administrative skills that comes with the aptitude which the course has given to you. And oral pathologist is also a very good, can make a very good hospital administrator. And I would say that again is a very plum job, because you know that the corporate hospitals are really flourishing and they're doing so well. So once you get your MBS degree, you can also try doing a parallel course in hospital administration, or you can take up a full-time hospital administration course immediately after your post-graduation from a reputed institution. And you will not believe, immediately you would get a very good placement and you would make up an excellent administrator, and that would really make you very financially sound. Now again, the same slide. So these are the consolidated points from the DCI curriculum. What makes up the postgraduate degree? We know that it's already made us wholesome, but I'm here to tell you what are the aspects we are learning and how can we make them as career choices. So many times I would say the current Gen Z wants to be on their own, make good money. And make good money. It's not just later, they want everything very fast and they want to be on their own. So if you are that kind, please understand that oral pathology is such a fantastic profession to be on your own. How come? Because you can actually start a diagnostic laboratory. Diagnostic laboratory services, as far as the compound annual growth rate data which is available, you can just check for CAGR, highest services which have the highest CAGR in India. So that data, if you can check, it would give you very clear feedback of which services are in most demand. Diagnostic testing laboratory are something which you can join a corporate chain, or you can own your own laboratory for yourself also. The next question immediately comes, ma'am, there will be a lot of money involved. Please do understand, bankers and the all your financial institutions are waiting to give a loan. Somehow, whenever I meet my banking friends, they say that there is a very big drop in people taking loans nowadays, and that is the trend. So there are people waiting for you to give financial support, and that would, of course, and the immediate question next comes: is there a matter of risk? Yes, there is always risk in everything, and diagnostic laboratory. Yes, if you do it in perfection, and if you have the right team, it would really take you places. So checklist for starting a new laboratory setup is something, yeah, very elaborate. It's something like a dental clinic, but it will give you a very big advantage. There are many of my students who have started a dental clinic, and they have a small laboratory setup in along with their clinical premises. So that would give you an added advantage, and you will be making a more aspect as well. So again, the CAGR data is something which you need to check up before establishing, and that will give you a lot of confidence. The other interesting aspect, which I've been telling my postgraduates from, I would say, last 8-9 years, there is a very interesting scope which is currently building up about the assisted reproductive facilities, which we have seen mushrooming all over the place. And that again gives us a big advantage of being an expert over there. Either you can be a part of the IVF laboratory group, or you can start on your own. How and why and are we specialized in that area? The first thing which is very, very important in an embryology laboratory is the microscopy, is the microscope. And nobody else is good at microscope than a pathologist. And the same applies for an oral pathologist also. So if you are very interested in the developmental aspect, I would say developmental biology aspects of the human life, embryology courses to get trained, it would just require 3 months to 6 months of intense training. The centers are available all over in major cities. I'm talking with so much of confidence because my own sibling, she is a medical practitioner, but she has her own IVF center. I've seen the processes, I've seen how it functions, and I have many times felt that it can be very easily run by a oral pathologist also, because it is in no way different. And you can, of course, if you feel that the technical aspects would be very, very, very sensitive, yes, please take help. But you can definitely be a boss and employ people. And this is something, a very big industry by itself. Of course, I don't have to mention about the CAGR rates for assisted reproduction services. It is huge. And this is the data of the CAGR value. And the next interesting thing again, as I was browsing through the CAGR values and the services which are most interestingly having the highest CAGR values in India, it was found that the chemical industries were actually ruling the market. And again, chemical industries, of course, they are very diverse in nature, but do understand, are we not familiar about chemicals? I'm not asking you to start any chemical industry, which is something beyond our premise. But what I'm trying to advise is that beautiful book of Bancroft. We actually know much more, and the basics of what stains are made, the chemistry of what the stains are made, and we are very, very, at least the basics are very clear. So having said that, why not do newer formulations? Why not do think of newer stains? Why not bring in newer formulas, and why not patent it? And that again has a very huge demand. As you keep traversing into that particular part of formulation and manufacturing, believe it, that is a very big universe by itself. And again, why was that told? Because we already are extremely good in understanding the basic chemistry of histopathology. And why is this slide coming up again? To show you what you already have learned or in the process of learning. And with that, what all can you make? So molecular techniques and biotechnology is something which is there in every original research paper, a paper which is from a Q1 domain, oral pathology related paper, will definitely have some molecular technique at least being done. And that will actually make you anyway be familiar with the topics. So if that really interests you, what all kind of work you can do. So you can either become a clinical or an experimental, take up clinical and experimental dental research, or you can work on clinical trials as an investigator. And this, of course, depends on how much of liking you have towards research. And as such, you can remain a core researcher as well. If you keep browsing through and if you're checking the amount of support which the government offers for women entrepreneurs towards supporting the research aspects, you would be surprised. There are so many opportunities which are available with the government, where they are helping us establish research centers. So research centers, again, who else can do the work better than oral pathologist? It is us who are extremely good in having or holding a research center. The other interesting area, which all of us are already familiar, is the medical insurance companies or joining as a expert in giving or clearing the medical claim forms. Many of my students are country heads in medical insurance companies. So that is something which actually something which we should actually look up if you are a kind of person who is very good in documentation or very good in that precision, looking at into precision, and those kind of personalities can, yes, definitely take up this particular job, because here the growth is very fast. The moment they realize that you are very sincere and you are giving your full to the job, automatically it would be you will be given a promotion very fast, and you can become a team leader in no time. And again, becoming country heads, once you become the global head or country head, you will also be given abroad opportunities, overseas opportunities as well. The other interesting area I would recommend for oral pathologist is medical publishing. Joining a publishing group is something, especially medical publishing, is something I have seen myself many times, because being an author of 4 textbooks and having worked with the leading medical publishing group, Olters Clover and Lippincott Williams and Wilkins, for past 2 decades, I would say that many times when our books were in the process of getting ready, there will always be either a medical graduate, or a medical or a dental graduate, or a dental postgraduate in the final process of proof reading. So they are called as subject experts, and those subject experts are very important for publishing industry, and they are really paid well. And but choose the best publishing house and look in for best options as well. Well, into overseas opportunities, you would be surprised again to know that when the moment postgraduate students join, the first advice I would give them is you have joined a very good course, which is good in abroad as well. So how in abroad? The moment you pass out with your MDS degree, the way you do your research is definitely, I would say, superior than your peers. Why is it superior? Because immediately you would get in questions as, my friend is in clinical side and he or she did a clinical study. Clinical studies are rated above, but do understand, a postgraduate course doing a clinical study of great clinical importance is not that easy. Whereas the core oral pathology kind of research, where you're looking into etiological aspects and so many other interesting things which a pathology can offer, will actually make your CV already very good after your postgraduate program. So that CV would immediately fetch you a very good PhD degree. And PhD degree, take PhD degrees which comes with a fellowship. So that will come once your CV is very good enough to attract a guide to take you as their student with a funded fellowship. And believe me, that is very easily possible with a oral pathology degree. And now we know that we are in the process of transformation, where AI is slowly taking over everything. We know that oral pathology is in the process of digitization much faster than what it used to be during our PG days. we really were aware of fractal analysis and so many things we used to do as PG students, yeah, way back. But the speed at which the transformation is happening is very huge. So how are you going to be prepared for that? Yes, that is something which you can do parallelly. There are so many AI tools. You learn them and then try to put it across digitization, and that also would give you an edge over others, and you can take that as a career option as well. So again, the moment AI comes, there is always an insecurity with every specialty. But do understand, we are healthcare service providers, and no matter how much AI improves, it can never match with human intelligence. So enhancing your human intelligence will automatically dethrone AI. So AI is only a supportive tool. So learn how to master it and learn how to utilize it and learn how to earn from it. So that would actually make a very big difference. So, having mentioned so much of opportunities, is it a treasure trove? The oral pathology as a career choice, is it a treasure trove? Yes, it is, especially to me. And I've still not spoken about many aspects which the subject gives. For the sake of time constraints, please do understand that as a oral pathologist, I've been given a special role in my institution as a head of oral biology. I've never told about anything about oral biology. So in that, I would quickly share something which I'm doing, something which is, I'd say, less traveled upon. So we conduct three interesting credit courses through our department. So the first and flagship program from our department is Taste Mastery, which is something because of our knowledge about oral physiology. Who else will understand oral physiology other than an oral pathologist? When did we learn about this? Because the first year postgraduate program starts with learning oral histology, physiology, tooth morphology, and then we go into oral pathology. If you do them thoroughly, then automatically there is a separate universe by itself, parallel universe, I would say, or a sister universe there residing for you to traverse together or utilize it however you want. So taste mastery is something which we do, and I would proudly claim that even five-star Michelin chefs um, do not understand something which is beyond the taste buds. The taste bud and the neuroscience connect is something what we know more than them. And it is that help which we can do to the food and beverage industry. So that is something which we can do from our end. And there are other two courses which we do with our expertise in tooth morphology. We do craniofacial sculpting, which is again a great hit in our institution by specialities of oral surgery and prosto, where they are more concerned about maxillofacial prosthesis. So we are the coordinators for that course. And another very interesting course, that is veterinary dentistry. Believe me, that is going to happen on a very big way, because again, dependence towards pets and yeah, silent partners are on the rise. And that is again a very breaking industry, path breaking industry by itself. How are we doing all those things? Yes, for craniofacial sculpting, we have a sculptor, professional sculptor along. And for veterinary dentistry, we have a veterinarian in our panel. So how is an oral pathologist involved? Because we know the morphology better, we know the comparative dental anatomy better, and that is how we teamed and we have made a course. So similarly of this kind, there are many things, and it is a treasure trove. Keep opening them, keep exploring them. And I would say first thing is keep assessing what gives you that high, or what makes you most happy, or what fascinates you the most. And once you find that out, give it your all. The first thing I would say is, as you open and as you keep checking all your chapters in oral pathology, that textbook of ours, the specialty of ours, just see which area gives you more happiness to read about. Which part of the textbook is more happy to read about, or which area is it the histopath techniques, or is it the immunohistochemistry, or is it the molecular biology? Anything, whatever it might be, just give it your all, and the universe would conspire and then give it back to you in whatever you do, and you would really be very successful. And I'm extremely honored and thankful to Dr. Mandana to having me given an opportunity in such a prestigious platform. Thank you so much, ma'am. And I'm also indebted to thank all my higher officials over there, without whom this journey would be incomplete. So thank you, and thank you for patient listening.
Thank you. That was indeed very interesting and covered a wide range of things that anyone can do. It was all really very interesting and well put together. And especially since some of it, at least, you have done yourself, so that's really interesting. And let's see. So let me just remind everyone if they want to put in any questions. And so, among the things that you spoke about, which you find is the best?
Uh, yeah, but that which would really take us places would be research, I would say, because uh, nobody can match our specialty in the depth of research which we can conduct, and that will be the one which can be translated for the benefit of the society, and we can play a very large role. You take up anything related to dental research, maybe just the urge to find the best restorative material, it starts from there. Any part of that dental research cannot be complete without an oral pathologist, because it is to us that every in vivo tissue reaction and most of the parameters are all related to our inference. We have to give the inference about how the research is proceeding and so on, and our inputs definitely will make a very big difference, because anything related to restorative dentistry comes up finally to pulp and periapical diseases, and that happens to be the most prevalent oral disease. So I would rate research the current trend to catch up the young minds, to catch up there and make a very big difference, because there are huge prospects over there. I would say we are not exploring on that area. It's not easy, but definitely possible.
Very true, very true. So, we have also a question. Let me bring it here. Yes, Dr. Vivek is saying, ma'am, can you please tell something more about how to get connected with the publishing house?
Yeah, that's again a very favorite question. So, I'm an author of four textbooks, and two of them are under the best-selling category. So, I'm actually known. Maybe my face may not be very familiar to the fraternity, but the name is quite familiar. And my textbook is one of the best-selling category in oral histology area. So, having said that, I've been traveling with international publishing houses for almost now close to 2 decades. Yes, we can definitely help you connect. You can take my connect through LinkedIn, or maybe Mandana ma'am can share it with you. I can definitely help you connect. Through either if you're looking for a job or if you want to become an author, yeah, in any way, we can definitely help. Yes.
That is very nice. Yes, it would be something that many are interested. And yes, I would not like to share your email in the open platform, but I think Dr. Vivek can just get in touch with me, and yes, I'll definitely give it to you. Also, you can easily find um, Dr. Ramya on LinkedIn. That's how I found
Yeah,
her.
so
So
yeah, yeah. I'm there all over the place in social media.
yes, so that makes it easier. And
Yeah.
there's another one. How can individual with dental clinics give their share in research?
Yeah, that's really a very practical question. Yeah, so what you can do is, with dental clinics, yes, it will be difficult, but those you are the ones, or those who are with the clinics, I would say, they know the problem which they face on a daily basis. So this I keep telling about in most of my lectures. So every mouth mirror, it starts from the basic mouth mirror to all the instruments which we put in practice. Everything can be made better. So the problems which we face in real time in clinic is what has to be addressed through research, and then we get a solution for it. So what you can do is, whenever you find a problem which you feel that this can be addressed in this way, or this can be solved in this way, please make a note. And if you are in connect with some of your, you can have friends who are there in attached with some institution, or they might be with some private biotechnology based companies. So you can, first thing I would say is establish contact. Your contacts are very very important, so please develop that network. And in that way LinkedIn works really wonderful. And it actually helps you connect. And most of the basic medical researchers are wanting such areas which would be prospective for them to come inside and then help you realize your dream. It's like that. Basic researchers are extremely good in conducting research, but what to do and what gap areas they need to address is what they are not very good at. So they would love to partner with a clinician. And there are grants, government grants, where um, you can actually connect with the academic researcher, and you can still be a private practitioner, and together you can apply for a grant.
Very good question and a very good answer. And just to add to this, the we have, as you might be aware, an Indian Society of Dental Research (ISDR), which is a association related to the international unit, and they actually have some programs for clinician researchers. So you can get in touch with them, and they will be able to help you, and they will be if you attend their conferences. I think for the longest time, I used to make it a point to attend 1 year oral pathology and 1 year the dental research conference. It just gives you a very different scope to see what everyone else is doing. Otherwise, we begin to
That's
look
brilliant.
so
That's
inward.
brilliant. Yeah. Yeah.
So just getting to see what. So that's what I would suggest you try, Dr. Vivek. And of course, he also says, sure, ma'am. And then we have Dr. Ankit Gupta, but his question is about forensic. So, what is the forensic odontology scope right now?
Okay, so yeah, I did forget to mention forensic odontology because that forms a part of oral path as well. Forensic odontology right now, there's a huge demand in all the educational institutions. So we see a lot of courses being started by many colleges. So right now, yeah, once you complete forensic odontology as a separate degree, yes, you can convince colleges to have a separate department by itself. And I feel it would definitely become a very big specialty by itself, and it would be given equal importance like forensic medicine specialists. And government also may consider taking a forensic odontologist in their team, because it is our resources which play a very vital role in the evidence creation. So all that definitely may happen in the future. And right now I would say colleges are recruiting forensic odontologists for teaching positions.
Yes, and to add to that, if you're watching, you're obviously watching this on our channel. So just look around on the Career Horizons playlist. There are at least 3 lectures which are about forensic dentistry and what it is like right now. So that will give you additional information. And of course, our next week's lecture is on forensic dentistry, on age estimation. So then next we come to Professor Hill. Yeah. So Professor Hill says, what are the quality assurance requirements in India for a private oral pathology laboratory? Do you have an accreditation system?
Yeah,
And there is a follow up to this, so let me share that also. Oh, sorry. So he is referring to ISO 15189 of 2022 accreditation.
okay. Yeah, Joe, I'm actually not very specifically, I'm not aware about the number of the accreditation system. But one thing I saw the presentation of Dr. Nagpal, no ma'am, Bhuvan. Yeah, Bhuvan's
Yes, yes.
presentation was there when I was just browsing through 360, and he has very.
Okay, what happened? Something happened. Hello, is my voice there? Okay, my voice is there. All right, yes, I can see. Okay, we seem to have lost Dr. Ramya for the moment. And okay, and he is
Get,
responding to. Okay, are you back? Okay. So, Dr. Nagpal, Dr. Bhuvan is answering your question. Yes, there is a accreditation requirement. And okay, we have Dr. Ramya back. Yes.
yeah, yeah, I'm sorry. Yeah.
Yeah. Yes, so
Yeah,
Dr. Bhuvan
brilliant.
was answering, and I just shared that since we had lost you.
Okay.
And yeah. So, anything else you want to say on this?
Yeah, and I would suggest, yeah, the laboratory would be the most ideal practical solution for an oral pathologist, considering our societal needs and requisites. So that would be a very nice investment and very nice option to take up. And I had very clearly projected the need for diagnostic laboratory, so none other than oral pathologists. But again, it's if you're planning to take it up, I would say you will have to undergo the basic, maybe work with someone, learn everything, and then take up start on your own. So that would be a better option. And also, if you're planning for a laboratory, it is better to do some management courses as well, a very short term management course as how to do your business management. Very short courses would make a very big difference. In that way, you'd really make very good money as well.
Yes. And I just shared Dr. Bhuvan's reply also is that his lab is got the accreditation and he is the authorized signatory.
Yeah, that's
So
very
that
promising. Actually, I really loved your presentation, Dr. Bhuvan. I watched the entire program. So,
and he is also saying excellent presentation for you. So
thank you.
yes. Okay, Dr. Vivek is saying corporate pathology labs give franchise and a helping hand to go for things like sample collection centers. Can we go for these?
Yeah, absolutely. Yeah. If the only thing is, the moment you step up with bigger brands, the investment slightly becomes more. But again, the investment becomes more, but obviously you can. It comes back to you. So there is a very good positive thing about the brand which will give money back is, yeah, obviously possible. You can go ahead if there is no constraints, financial constraints. It would be a better option.
Yes, he has one more follow up to that. Can we start with basic routine lab tests?
Yeah, you can start. I would recommend having an automated analyzer to begin with, because your results would be more precise and more trustworthy. And instead of relying on technical people, because they are the ones who might keep switching on to other labs, it's very difficult to keep that kind of strata of employees in a to hold them together, so keep them for a longer run. So the automated machines would be very very helpful to run your basic testing, and that comes with a reasonably good price as well.
Yes, actually, I don't think anyone really does much of any manual testing anymore.
Yeah, nowadays, yes, yes,
It's so different from when we probably studied. Yes, I can't think any lab I have gone or done anything with that was actually doing anything manual. So,
correct.
yes. So in fact, the technicians who are there, their job is now limited to just loading everything into the machine and then taking a
Yeah,
printout of the report.
venipuncture is what maximum they need to know. Yes.
Yes. Right. So that's our last one, I think, there. And okay, so he's saying thank you. You're welcome.
Thank you, Dr.
And
Vivek.
and I think we have answered everything and we have seen everything. So okay, while you all get a minute to actually mull around and think about any other question that you have, let me just, and I hope I will be sharing the right thing. Okay, I want to, all right. So I was just saying what is next week is about forensic dentistry. So we are having a lecture on dental age estimation about the most recent ways to do it and like contemporary to avant-garde presentation of what it takes to do an age estimation by Dr. Augustine from Maulana Azad Institute of Dental Sciences. Do please remember to mark it and join us for that. All right, let's see. Did anything else come? Okay. So let me share your certificate in the meanwhile. Thank you so much.
Thank you so much, ma'am. Thank you once again. It was such a nice opportunity. I keep cherishing it because your presence in YouTube is very, very wide. I keep watching it, and I'm really happy to be in that platform. And I would really appreciate your efforts to showcase oral pathology. It feels every time I see a notification from your side, we need people like you to, I would say, make our specialty more sound more positive. So you give a lot of positive vibe to the specialty itself, and that's what is more important. So thank you so
And
much.
thank you.
Keep up the great job which you're doing. Thank you so much. Thank you.
Thank you so much. I can say very frankly that by the very simple fact that we did not know each other up till I guess I sent you a message on LinkedIn,
Yes,
and the very
yes,
fact that I could find you on LinkedIn says you're doing a lot, and all of that helps, of course, with making the speciality stand out and be better recognized. So that's a lot of contribution you're doing yourself.
thank you so
Well
much.
done.
Thank you. Hearing
You're
it
most
from you
welcome.
means a lot. Thank you. Yeah,
Oh, thank you. You are very, very kind.
thank you.
Okay, let's see. Professor Joss has something to say. Is it better to start an independent tissue diagnostic and microbiology service or cooperate with a general lab service?
Um, Independent, yeah, tissue diagnostic. That depends on how much of time and how much of money you can invest upon. So I would say to begin with, it is better to tie up with some lab and just do the outsourcing. You can have it in your own brand or whatever name you want to, but initial stages, just send the samples to somebody else, outsource it, get the work done. So in that way, your investment would be lesser, and at the same time, you can make a very big difference, and it will also give you a lot of confidence as well. So to begin with, yes, please take up a general. Tie up with some other group, but you can run the entire show in your own brand. That way, it would really help to kickstart. And after that, once you're really having a very sizable sample size and you have established yourself, yes, then from then you can carry on with your own yourself, when you can establish it independently.
Yes, I guess here, especially for what I would say for surgical pathology, the easiest is since the samples may not be that many, is you tie up with someone who does the processing for you and gives you the slides to report.
Exactly.
Just
Yes, exactly. Yes.
it is the most practical. Yes, that's true.
Yeah.
Because in fact, I would say that even the pathologists that I know are no longer getting enough tissues in their individual practice to be running the actual processing themselves. Even they give it to
Yeah.
someone else to process. Yes. So, okay, I think we have sort of done everything. We have seen everything. You want to give any wrap up comments?
Yeah, I would say just feel proud about your own specialty. If you aren't feeling proud and if you feel that there's less scope, you have not explored its intricacies. So there's a lot the profession or the specialty can give you, and keep exploring. So thank you so much.
Very true. It's like my go to bit of advice is this: starting out in any field of work, in any specialty, in any branch, any discipline, is tough in today's world because there are many people of everything. Whatever you may think of, you are not the few that used to be there earlier. So there is competition, and you got to work. So it's not especially what has happened, maybe seeing our generation, the younger oral pathologists, especially in India. I mean, we had a good time. We just sort of walked in to a job. It was like you finished, you got the job. But that is not the case, and that was really rare for us. It is not the norm. It is not the norm to be expected for any branch. So just remember, you got to get out there and you got to work and you got to get very, very good at what you do. And then there'll always be a place. I mean, I always think there are examples, so many examples of extremely successful oral pathologists. So there really is no reason to think that there's anything wrong with the branch. I think it's a marvelous and it's a very interesting branch. I would have been bored out of my skull with anything else much before this.
Correct.
Yes. Okay, we will wrap up with Dr. Bhuvan's comment. Wonderful career opportunities explained by ma'am. Happy to connect with her. Yes.
Yeah. Looking forward, Dr. Bhuvan. Yeah, please do connect. Yeah, thank you.
Okay, everybody. So it was lovely to have you here, Dr. Ramaya. I do hope you will come back for a regular lecture. Now we did
Oh,
the
yeah, that's
the
so nice
career
to hear.
thing.
Anytime, ma'am. Anytime. Yes.
Yes, thank you. And
Thank you so much.
everybody, you're most welcome. Always a pleasure. So, everybody, please remember next Tuesday, coming Tuesday, we of course have a program at our regular time. And until then, be well, be happy, and see you all.
Yeah. See you. Bye.